Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your weight questions, you are in the right place. Welcome. So before we get into the questions today, I have great news, and that is I am bringing back daily YouTube shorts for all of April. So it's office hours. Every day I'll be answering one of your questions. So keep sending the questions in. I have so many questions already, so I'm just going to do as many as I can. And that will be April office hours every day as well. And I'll continue to make the regular long form videos too, but that is what is coming in April. Let's get started with today's question. So first question is, and as always, if these are a little personal, I'm going to change them slightly so they're more broadly educationally relevant. And also because I can't answer personal medical questions because I'm not your personal doctor. But, okay, first question. I've been on Zepbound for 6 months now and only lost 10 pounds from 160 to 150. I've just recently went up to the 7.5 dose. I eat way less and only twice a day, and I don't understand why it's coming off so slowly. I'm 65 and I'm not taking any medication that should interfere. I used to be on low carb, but I can't do that any longer due to my blood sugar getting too low in the Zepbound, so I have implemented more carbs. Would you be able to give me any tips to accelerate my weight loss? What a great question. So I'm going to change this a little bit to make it more broadly educationally applicable. But basically, if somebody hasn't lost if I have a patient, they haven't lost all the weight they want to lose yet, they're still kind of mid-range on tirzepatide or semaglutide, I'm usually, as long as the side effects are not a problem, going to plan to titrate them all the way up and see if we can get to that 15 to 20% total body weight loss that is on average expected with those medications. And then, of course, at the same time, I'm also checking their labs and I'm also making sure that there's no medication that's interfering. And this is also where I really encourage people to get very, very nitty gritty about what they're doing lifestyle wise. So are they eating in the exact healthy manner that they want to be eating? Are they eating a lot of fruits and vegetables? Are they listening to their body? So a lot of times what's great about these medications is they really force people to listen to when their stomach says, ding, ding, we're full. But if I have a patient who is eating and they're distracted when they're eating, if they feel like they need to get to a certain calorie count and they're doing that before listening to their body, these are all things that I would be discussing with my patients. So if they are exercising exactly how they want to exercise, then I'm also taking a good look at how exactly are they eating and because there might be some wiggle room there if I had a patient like this. So are they getting their protein? Are they getting lots of fruits and vegetables? Are they hydrating? But above all else, are they listening to their body? And you do have to be a little careful because, of course, some people, their appetite is very suppressed. But, there's a difference between someone who's eating twice a day and they're eating a lot of fruits and vegetables and lean protein and healthy fats and they feel really good on that. And then there are the people who haven't quite changed how they are eating yet. And so they're eating similar to how they were eating maybe before the medication. Maybe they're eating more processed foods. Maybe there's more salt, there's more saturated fat. Maybe they're still doing takeout. So they might not have really changed what they're eating. They've only changed the size of what they're eating. And so if I had a patient and they're kind of in more of that second category, that's also a place where you can make a lot of lifestyle changes that will probably help with weight loss. Either way, you're going to be feeling better if I have a patient like that. But that also can be a good place to get some leverage in terms of getting your money's worth from this medication. But also, if I have a patient like this, I'm definitely going to be titrating them all the way up to see where they are once they get to that 15 milligram dose. Because 7.5, if I have a patient who's only lost, 5 to 10 pounds at 7.5, they're only halfway there. So the game is not over yet. So that's what I'd be doing if I had a patient like that. But thank you so much. What a good question. Next question. Thank you so much for the information. I'd like to know if losing at most a pound per week at 10 milligrams is very slow for Zepbound. I haven't had any side effects so far, and I'm considering going to 12.5. It just seems very slow weight loss. I'd appreciate your thoughts. I'm a senior, active with exercise and weights. Great. Sleep 7 hours, great social life, and honestly, I have little stress. It sounds like you are doing amazing, and I love that. Yeah, so what pound a week is a pound a week. It's still, the trajectory is still going down. And so if you are not at your goal yet, it's moving in the right direction. And some people are going to move faster and some people are going to move slower. But either way, it's going the right way. So if I had a patient that's losing a pound a week, I'm not bothered by that. To me, it's also more important how they're feeling. And so if I have somebody who's losing a pound a week, they're feeling really good, as people get to, kind of stabilize on each dose, the weight loss is going to taper off. So it doesn't mean that it's not working. It's just, at each dose, someone's body is going to find their new normal level. And so if I have a patient who's losing a pound a week at one dose, their body still hasn't found that normal level, but everybody's pace is different. And I do find that sometimes even on, dose to dose, the rate of change can be slightly different as well. But some people overall are just kind of fast losers and some people are slow losers. But the bottom line is you just want to make sure the overall trajectory, the overall slope is going in the right direction. So if I have a patient who's losing a pound a week, I'm not bothered by that. But I am also, as always, going to be thinking about getting all my patients to that top number, that 15 milligrams, unless they lost all the weight before they got there or they're having a lot of side effects. But in general, if I have a patient on this medication, it generally means that they would benefit from losing 15 to 20% of their total body weight. And the way that I know is going to get them closest to that is if they titrate all the way up, because these medications are dose dependent, meaning that the higher up you go, the more weight somebody is going to lose. So if I had a patient, they're losing a pound a week, they've done at least 4 weeks on this medication and they're feeling well, I might keep them there for another month, or I might increase the dose. Really depends on what the patient is looking for. But if they're a little frustrated with the pace, yeah, I would think about going up to the 12.5. And of course, ultimately, the goal is that they get to the 15 milligrams and see what their weight does when they're there. What a great question. Thank you so much for sharing. And I'm glad things are going so well for you. Okay, next question. Do you have any, these next two questions go a little hand in hand. They're kind of two sides of the same coin. Do you have any information on having rheumatoid arthritis and taking a GLP-1 to help with inflammation? Would like to hear your thoughts on this. And then question number 2 in this category is it safe for a patient with Crohn's disease currently taking Rinvoq to start a GLP-1? So both of these are inflammatory autoimmune conditions. And of course, I can't answer personal medical questions, but I will talk about this in general, which is that, when we have a lot of excess fatty tissue, that essentially is functioning as its own endocrine organ, and it can be very inflammatory. So even if somebody does not have inflammatory disease issues, that in itself can be very irritating to them. So it can give them body aches, joint aches, maybe skin issues. It's just, it creates a more inflammatory state for the body. And so if somebody already has an autoimmune disease, more like their body has essentially kind of turned against them in one way or another, whether that's rheumatoid arthritis or Crohn's or psoriatic arthritis or one of many medical issues. Of course, if someone also has extra fatty tissue, that's only going to make things worse in general. So it can be extremely beneficial to remove some of that extra fat, not just from a BMI health standpoint, but to see if it might improve these symptoms of, it's not going to cure the autoimmune issue, but it certainly may help with the symptoms that they're having. So in general, it's only going to make things better. And of course, if I have someone who has a significant autoimmune disease, I'm definitely getting their specialist on board to make sure that they don't have any objections. But usually it is not a problem, and it usually only helps. And even I have patients who have ulcerative colitis, I have patients who have Crohn's disease, and of course, for anybody out there who has that, you definitely, you want your doctors talking to each other and making sure that your GI doctor is okay with you being on this as well. But for me, I do have patients who have inflammatory bowel disease and they can do very well. They also are very aware that, things might get worse before they get better. And it really depends on the person, but especially for people who already have underlying gastrointestinal issues, it's a little bit of rolling the dice, but many times it's okay. Very patient dependent. So, but it's certainly, for me, it's not a hard stop. Like if I have a patient with rheumatoid arthritis, if I have a patient with Crohn's, ulcerative colitis, for me, it's not a hard stop in terms of, okay, this is definitely not somebody that I'm going to discuss these medications with or think about putting them on one of these medications. So great questions. Thank you so much. Okay, last question for today. Could you talk about creatine, please? What's your experience with people taking it while losing weight and lifting weights? Thanks. Okay, first of all, I love that you're lifting weights. I love it when people are hitting the gym when they're on these medications. I love that. Building muscle is only going to help. So I'll be very transparent. My patient population is not, there's not a significant portion of it that is made up of bodybuilders. But I will say that, creatine in itself, for me, if I have a patient who comes in and they're taking it, it doesn't bother me. I just want them to use it safely because, like any supplement, you can certainly take too much of it. And of course, there are things that you want to be careful with if people are taking supplements, but especially with creatine. I want to make sure my patient's kidney and liver function is okay. I want to make sure that they're not pregnant or breastfeeding or planning on becoming pregnant. These are all things to take under consideration. But it certainly wouldn't prevent me from prescribing a GLP-1 medication. And usually if people are on creatine, it means that they do go to the gym a lot. They are invested in building muscle. And so that's always a great mindset to be in if you're going to be on one of these medications, is building that muscle. And so you're preventing that muscle loss, but even hedging against it and building muscle. Because every time people lose a significant amount of weight, a small percentage of that is going to be muscle. And we really want to prevent that from happening. But for me, I have to say, again, I don't have a lot of patients that are in this general population, but it wouldn't bother me if they were using creatine safely and they wanted to do tirzepatide and they fell into that category of someone that would really benefit from it. I wouldn't really have a problem with that. What a great question. I'm excited for April and all the other questions that I get to answer every day. Thank you all so much for sending in your questions. If you have a question today, you can leave it on this video. You can leave it on another video and I will add it to the list. But yes, be on the lookout for daily office hours every day, YouTube Shorts, same channel, and of course the 2 videos per week, the long form videos. If you want to work with me directly, you definitely can. I do work as a life coach to help people with the non-medical aspects of weight loss as well. So I will leave that info down below. Thank you so much for watching. If you're not subscribed to my channel, subscribe, because it's the place for medically based answers to your weight questions. Thank you so much for watching, and please be well.